Gotta drink your water, right? Whew, what is up, guys? It's your boy Mike. Now, today's kind of a different kind of video. Kind of just want to ramble a little bit about this company. We are talking about Abcellera. Now, I am not a biotech genius to say, right? But honestly, I think this company is doing something special. Um, I've seen a lot of biotech companies, and usually, when you invest in biotech, most people are losing money. Let's just be honest, right? Short the bat, like you're most likely going to lose money if you're not a doctor, if you're not analyzing cells, proteins, molecules. You're probably going to lose some money, like you know what I mean. Let me move this desk up, but I don't know, like whenever I hear Abcellera, I don't know. It just kind of like, I don't know, something is going on here, right? I mean, don't get me wrong. The company has no revenue. It's not profitable yet. They have enough liquidity, like they have enough cash on their balance sheets, and they do have a long runway. Plus, on top of that, the technology that they have, right? So, I mean, if they could like hyper focus on that technology and just hammer down on the technology and increase the speed of antibody discovery. I mean, we we got something pretty big here. I'm not gonna lie. You know, I mean, I'm not an expert when it comes down to their technology, but I mean, it's pretty fascinating. You know, I mean, most companies most biotech companies, right? They tend to actually go through the whole process of developing a drug, right? So they look at the whole process of developing a drug, and they're trying to outsource certain things. But this company, they're like literally focusing on like the fundamentals. How can we speed up the drug discovery process while also making it cheaper, right? And like I feel like that's literally what they've been doing, right? I mean, they have been getting royalties from other players in the game. Um, like there's a lot of companies that, you know, outsource the work to this company, and they've just been hammering down. Um, I don't know. This company is pretty interesting. Like, but like right now, they have if I look, let me take a look, right? They have the menopause hot flashes drug. It's already in phase 2, and I think, let me see, if you look right here, which is something new, they did say that they're going to reveal the safety data, uh let me see, on Monday, right? So on Monday, May 11th. That's pretty good news, right? So we're gonna get more information about this drug, right? Because I would say this is like the main one. Like if we can get it to pass phase 3, like let alone phase 2, right? Once it gets through phase 2, you feel good, but we still need phase 3, right? But I'm really hoping. I think right now they have about what, like I think 4 drugs in development. They kind of keeping the 2 other drugs a bit of secret. Um, but like I don't know, if they pass phase 3 in the menopause and in the other one, and they still hammering down the anti-discovery process, we might see free cash flow per share just accelerate. Because I mean, you're doing something that most pharmaceutical companies are not going to really do. right? Like this company is literally hammering down, okay, how can we find the most efficient antibody um as possible? Like and see, okay, we find the antibody and then we make it more efficient, right? I don't know. I mean, listen, it's a pretty interesting company, and it does make you think like, what is really gonna happen down the line? Like, are we gonna get like, is this company just gonna just pass every single drug? I don't think so. But you know, if you could increase the success rate on these drugs between 20% to 70%, that is pretty crazy. I don't think you guys understand. Like when they find, I mean, I'm not too sure how they find their target. Like, what are the characteristics of the virus or like protein that they're trying to find to have the easiest target? I'm not too sure what their process is, right? You have to be like an expert to know. But if they could increase that success rate and really boost free cash flow per share dramatically to the point where you won't be able to understand it, it's gonna actually like it's gonna push the FDA to reduce that timeline, right? And I'm speaking a little bit too far, right? That's probably not gonna happen. The FDA, they take this shit seriously, or whatever company that controls the IND. I think that's what it's called. Like whatever company that controls the process. Like, cause usually to create a drug, it takes about 8 years, right? Like 6 to 8 years, sometimes 10 years. So if this company could literally reduce that time with their technology, I don't know. I don't know. It's gonna be crazy. Like I don't know. I'm talking years ahead, right? I'm talking years ahead. I'm sure this is no easy task at all, but it just makes you wonder, right? Like it just makes you wonder, like, damn, because like that's it. Like it's crazy, right? Like there's a reason why this company haven't developed drugs, like created their own drugs in the beginning, right? They didn't just say, all right, we're just gonna go straight to the full process of developing these drugs. No, they literally hammered down on the discovery process and only focused on that. Okay. Because when you go through these trials and stuff like that, you are spending millions of dollars, right? So if you're gonna test your technology and test your process, you don't want to be creating these drugs immediately, right? You want to take outsourced work and you want to continue in like hammering down the technology that you already have with the processes that you already have in high volume. And when you're able to do that, you're able to get more data, and that data is being sequenced at a high rate. Like, yeah, no, it just makes you think, what can Abcellera really do, right? Because they've been playing the volume game for a while, right? They've been doing that for a while, so they have a lot of experience of hammering down on finding the right antibody. And then if you talk about their, I don't know if I'm pronouncing it right, the microfluidics technology, like, you know, yeah, I mean, it just makes you wonder, right? If you scroll down here, like, I made like a little uh quick quick information of the technology. It's pretty interesting, right? to like isolate single cells into a droplet, right? Like, yeah, I mean, listen, this is really, really advanced, right? Like, I'm not too sure how the old way of doing things like this. I'm sure it's obviously it takes a while. I did actually looked into it, but I can't. It's so complex. It's just like I won't be able to explain it. It's just so much going on, you know. But let's just say the old process, it took forever. It took forever. Like they were doing a lot of guesswork. It's a lot of guesswork. So, because yeah, it's pretty crazy. I mean, if you guys don't know, I don't even know if I have enough time. I'm going to leave out pretty soon, but like let's just say this is how it works, right? Like with the process, if you haven't got it already. Usually when you're trying to find a target, first you got to find a target. So let's just say the target it's a certain disease, right? I'm just going to say what? HIV, for example, right? That's a virus, right? So first you got to find like okay, boom. Actually, I can't even explain it. It is very complicated, but you got to find somebody that's able to like mostly beat the virus, even though that virus is basically almost impossible. I mean, I know a company GeoLead is in phase 2 right now with the drug, but yeah, you got to find somebody that actually beat the virus on its own, right? So you find a person that beats the virus on its own, and then you wanna literally go into their B cells and find out which antibody was able to attack that target efficiently. And then once you find out that antibody and you test all the antibodies to see which one is more efficient of tackling that said disease, you then want to make it more efficient. And then, that's really how far it will go. Uh, mind you, I'm not no expert at this, you know. Um, but yeah. I mean, listen, it's a very interesting company. They have they have this technology that they will be improving with more data, So yeah, like this data is gonna get a lot better, and they're just gonna keep on hammering down in technology. Like I said, they have I don't know if I said it, but yeah, they have $700 million in cash. They have a long runway. Like, you know, we could see this company go for 6 years. They could be hammering down on their technology for 2 years before we see something crazy. Right. I mean, like right now, we are literally in an inflection point with AI. Like AI is literally a tailwind for biotech. It's a very interesting time, right? Because you need data. Like data is like key when it comes up to biotech. Usually with biotech, they tend to guess and try to figure out, okay, does this work? Does this work? No, like AI is gonna actually accelerate that process even better. So yeah, I mean we live in interesting times right now. Like, you know, if they could pass this, get this drug together, get this going, it's it's gonna be crazy. But yeah, I'm curious to know what's gonna happen in earnings, right? I really want to hear, okay, how is this drug performing, the safety rating, all of that, and I I'm very interested what Abcellera is able to do because you know, um, and yeah, I mean the CEO, I will say, like, I mean he doesn't really talk as much. I try to watch as much like interviews as possible, but usually like these interviews has been years. Um, I gotta admit though, I do love the bald head though. I hope he keeps that. That I don't know, like I don't know. He kind of reminds me of somebody in a Black Mirror episode, but I don't know. Like I could be bugging. If what was it Cole Hansen? Most likely I said your name wrong because I pronounce every single name wrong. If you are seeing this, listen, my fault. I'm sorry, but listen, I yeah, can't wait to see what this company got. And I will say this will be the only biotech company that I invest in. Literally. Um right now this company is 10% of my portfolio. So I don't know if I plan to increase, but we'll see how it goes, right? Because I am an amateur when it comes down to biotech, and I'm trying to learn as much as possible in this space because I do look into my health a lot, right? I mean, my health is very important, and I try to understand like the biology of like how we were created and the nucleus, the mitochondria, all of that. Um, it's very interesting. But yeah, I mean, yeah, if this company could literally speed up the anti-discovery process at least by like 60%, I mean, it's going to be huge. The fact that you just increase the success rate dramatically when most biotech companies are failing, like we have these drugs that fail in like 70% of the time they're failing. Right, mind you, a lot of investors, they lose a lot of money in this shit. So listen, man, I don't know, I feel it. I feel it. I can feel it. But yeah, I mean, listen, tell me what you guys think in the comment section below. Thanks for watching, and I see you in the next one. I might actually do the earnings too. I might stream the earnings. Why not? Nobody does that on YouTube. Whatever. But yeah, peace out. See you in the next one.